You're listening to The Local Lens from the Powell County Health Department and Kentucky RIO.
And we have great people in Kentucky working on this problem, statewide and particularly in eastern Kentucky, from folks at the State Office of Rural Health, because it's an urban problem, but it's a significant rural problem, and particularly in eastern Kentucky, which we're part of here. We're in the central eastern part, but I think we really got people that care. They're passionate about it. They want to help people, and they're practical in the way they want to do it. So.
And I think the number one thing that, if you're going to be in a role such as you have to love people, and you have to want to be on their level. You have to want to be empathetic or sympathetic. The problem is multifactorial. It's not just that they woke up one day and said, hey, I want to be a drug addict. It's layers of complication that play into that. It's lots of socioeconomic factors. It could be a breakdown of the family. It could be abuse, depression, anxiety. There's so many things that play into that. And you have to be willing to love people and to be a good listener and to build that rapport with them, to let them know that you care.
This week on The Local Lens, we are joined by Donna and John Isfort from Estill County, Kentucky. Now, these two people are absolute rock stars. They are very practical in ways that they help in the addiction and recovery world. They both have their feet in lots of different areas, and we can learn a lot from them just about how to look at a problem that exists and then how to go about doing things to solve the problem. So that's what this episode's focus is on. Thank you guys for tuning in. You're listening to The Local Lens, the podcast from the Powell County Health Department and Kentucky RIO, where we go inside our community's experience with the drug epidemic. And we're doing that through having these interviews with people who have unique perspectives on everything. And these two have a really unique perspective in that they're looking at the whole big picture and they're backing it with action. So let's go on and get into it. I'm your host, Nate Brooks. These are our people using our voices, telling our stories, because no one sees it like we do.
Well, good evening, everyone. I'm Donna Isfort, and I am a nurse practitioner at Estill Medical Clinic.
And I'm John Isfort, and I'm her husband, and I help with the business side of the clinic, and paramedic by training years ago.
Well, it's nice to meet you guys. Thank you so much for coming on our show. I know.
Thanks for having us.
Yeah, absolutely. Leandra Knox is also in the room with us.
Mm-hmm.
Yeah.
It's our anniversary, actually.
Oh, happy anniversary. Yeah, what a wonderful way to spend it. And Donna actually owns the clinic that she works at. So these two really have their feet set in the medical field in a unique way. And John even has a history working in health at the Markham and Wallace Hospital in Irvine.
In my previous job, when I worked at Markham and Wallace, I'd been involved in that area for probably about 6 or 7 years. And we tried to address it through some federal funding. We started the quick response team here in Estill County, the overdose task force, and those things to really understand what the problem was that we had in the county. So when we started that, we wanted to gather some data, be able to look at the data and determine the real issue, and then determine a plan on how to attack the drug problem in this community. So we've really looked at it from the day-to-day patient care with Donna, and then I've looked at it more globally, and trying to put a system in place to be able to address it.
John is actually chair of the Estill County Ambulance Service, and I also serve as board chair for the Estill County Board of Education. So not only are we involved at Estill Medical Clinic and obviously own the clinic, but we are very involved in our community in all aspects. And John and I both are very involved with our church and our church family at Crooked Creek. And so we see the big picture. We're involved in all aspects of the community.
What would you say addiction's role in the big picture here is? Is that, it's a huge question, I know, but if you could put it into like 2 or 3 sentences, what would you say addiction's effect on the whole big picture of Estill County is?
Well, one of the things that John has said over and over this past year is that we have a pandemic with COVID, but we also have an epidemic, which involves the drugs and the drug addiction problem that we have in our community. And we have lots of data to support, what we're saying, and that we truly have an epidemic here in rural Estill County. And a lot of people may be in denial about that. A lot of people may not think that, it happens here, or it happens to me, or it happens to my family or friends. But the real truth of the matter is it's here, and it does happen. It's no respecter of persons.
No, that's exactly right. And it impacts all families in some way. I would venture to say that in Estill County, there's not many people that haven't been touched in some way by what's going on with the drug problem. In addition, it's an economic issue here in the community. It's a workforce issue. So all the things that go with that. It's a school issue. Obviously, Donna was talking about that, but it impacts more than one person, the one that's addicted. It impacts the family, it impacts the extended family, the workforce. So it's much bigger than just one person, and that's why it's a multifactorial way that you have to address it. You can't just address it as one person, even though it's one person at a time, but you got to address it more globally.
So there are immediately 1,000 questions that come to mind. The first one, though, is you've both already mentioned data. Not many people actually do mention data much in these interviews. What role does data play in all of this for you guys?
Well, it's huge. When you look at Estill County in 2017, we had the highest overdose death rate of all 120 counties. Now, 18, it did go down, but the data was incomplete in 18. In 2019, we were number one again. That's not a stat that you want to be number one in. So in 20, and that was the impetus to get one of the grants that we had, and so that's when we started the OD task force in the middle of 19. And it would have been higher had we not done that. And that's really a community effort. Many agencies coming together to really look at it in a multidisciplinary team and determine what's the best route or the best course of action to take with that. So in 2020, the death rate went down. However, 2020 is the pandemic. So other issues that we see with that is the emotional impact, increase in suicide, increase in behavioral health emergencies. So we saw that in 2020. As of today, we've had 8 overdose deaths in this community. If we stay on track, we're not even 6 months into it. We're nearing 6 months, but it's not 6 full months. If we stay on track with that, we'll be number one again. So
data plays a huge part of being able to, you know that you have a problem, but once you have some statistics, it backs up what you already know. And then in addition to that, if you want any funding from a federal aspect to try to get help, you have to have data just to apply for federal grants, and Leandra knows all about, the funding and everything for those grants, but you have to have the data to support what you already think or already know.
And you don't know what you don't know. And I think it was really a shock to us to look at the data in 2017 and say, wait a minute, we're number one for this. And a lot of the agencies locally did not know that. We didn't know it until we started investigating that and looking at the data. And so that when you say that you're number one in that, that really wakes people up to the issue.
So having that data is endlessly important, but a challenge, and what a lot of people's jobs are, is gathering that data. So we asked how they got theirs.
Number one is Kentucky issues an OD fatality report that comes out of the Justice Department annually. So that's where you can get the fatality rate per county. You cannot get the total overdose rate. What we started doing when we formed the OD task force here locally is we developed or implemented rather an OD mapping program. Where we started putting data into this program, and we could track the overdoses in our community. You could see trends, what day of the week that is happening, what time of day. And it's a free program offered by the U.S. Justice Department. And
you could even identify certain pockets within the community that the overdoses were occurring in. And so that would help you be able to identify problem areas. So we were able to take that. Yeah, we were able to target those areas.
And it's really accurate when you get some historical data. You're actually able to forecast, based on that data that you have. And but the key of it is you got to have more counties reporting in there. Kentucky has probably, I think the last time I talked to Misty, she may have mentioned that in her podcast, I think we're probably 25 counties that are reporting out of 120. So we need more counties to report.
Because the more counties you have reporting, the more full and telling and informative your map is.
And so what you can do, as John was sharing, you can start to predict trends. So we know if Madison County has 10 overdoses on Tuesday, then we know that probably Thursday and Friday we need to be aware that we could possibly be having situations here. And the same goes as up north. If we know Cincinnati has a lot of overdoses and they report on OD maps, we know that it's coming down Interstate 75 and it's headed our way.
And almost every county in Ohio reports in OD maps, so that makes it very beneficial. And through our friends at the HIDA task force, they were able to tell us really the route that you see illicit drug trafficking, and a lot of that comes through the north.
Now, using these maps is it's a smarter way to fight this because it gives you a leg up. But anyways, so let's see, when you were doing the task force then, the task force was at least effective in getting these things started. Who all was involved with this task force?
Yeah, it's a great question. What we did is we brought all of the healthcare folks to the table. Then we brought the public safety folks to the table. That's your EMS and your police. We brought in law enforcement, the county attorney, the judge,
the health department,
of course the health department. That's your public health component of that. And so by bringing everyone to the table, we're all on the same page, and we can address the problem as a group rather than trying to work in silos, which often happens like that. So it really worked out well for us, and it's still going strong, and I think they have a meeting on Thursday. We attend that meeting as well as part of the clinic because we're a partner in that. But it's a multidisciplinary team. Everybody brings a different angle. Police bring a different angle than healthcare. But when you look at it, again, it's an OD task force. It's not a drug task force. That's the law enforcement side of things.
Okay.
But what we're looking at is how to prevent overdose deaths.
Yeah.
That's what that task force does.
Has the buy-in for that, has it been pretty good from all the different groups?
Oh, yeah. I think it's been great. Yeah,
Absolutely.
Well, good. Good.
Again, I think that's where the data comes in. When you talk about that we're number one in the state for OD deaths per capita, that gets folks' attention.
Yeah.
Not to get political or anything, but Hillary Clinton said before that it takes a village to raise a family. In this case, it takes an entire community to fight or to combat the drug addiction problem that we have. It's not that we operate in silos. It's not a one person. It's just not one person that can solve this problem. It takes an entire village, an entire community.
Yeah, and I think, the strategy, when you look at it, what are you going to do to push the death rate down? Well, what strategies do you have? So the OD task force, when you look at it, the number one strategy is to get Narcan out there, naloxone, the antidote. And if you get that out there, we anticipate we would push the death rate down, but probably would increase the OD rate. Exactly what we saw. That was anticipated. So, but what we were looking to do is to stop the dying. That was the chief objective of the OD task force.
So they've done some interesting things to go be with their audience that they were trying to reach.
And so we would give away a donut, and we would give away a Narcan, and here's a cup of coffee to go with it. And, it was just ways to draw people in. And plus, we tried to put people at ease and tried to help them understand, hey, it's okay. We understand. We're not here to judge you. We're here to help you. And so I think once they start to put down those barriers and put down those, and open up, I think people were a lot more receptive and willing to take the Narcan, to take it home with them, because there's a huge stigma that goes along with some of that. We want to go to the people. Sometimes people think that the actual clinic is behind the doors inside the office. Well, if you run a health clinic and you're concerned about your community and the health of other people, sometimes you have to go to them. You have to open up the door, and you have to put yourself in the back parking lot, or you have to put yourself at community events. So we are here to provide health care, and so sometimes we have to go to them.
So what we have here with these two people is this mixing of three very important things in this fight. The first is a knowledge of the healthcare side of it. They're aware of how the human health works and also how the healthcare systems work. And then the awareness of the data and knowing how to use that data. And then there's also just this huge amount of care for the community. When you mix those three things together, you have some effective work.
And we have great people in Kentucky working on this problem, statewide and particularly in eastern Kentucky. From folks at the State Office of Rural Health, because it's an urban problem, but it's a significant rural problem, and particularly in eastern Kentucky, which we're part of here. We're in the central eastern part, but I think we really got people that care. They're passionate about it. They want to help people, and they're practical in the way they want to do it. So.
Yeah.
And I think the number one thing that, if you're going to be in a role such as we, you have to love people, and you have to want to be on their level. You have to want to be empathetic or sympathetic. The problem is multifactorial. It's not just that they woke up one day and said, hey, I want to be a drug addict. It's layers of complication that play into that. It's lots of socioeconomic factors. It could be a breakdown of the family. It could be abuse, depression, anxiety. There's so many things that play into that, and you have to be willing to love people and to be a good listener, and to build that rapport with them, to let them know that you care and that you're going to try to walk along this journey with them and help lead and guide them. But with all of that being said, they have to understand that you're going to call them out when they're not
accountability
doing what they're supposed to be doing. So
absolutely, and we say that often, and that's a great statement. We often say, no one at 12 years old says, I want to grow up and be addicted to substance, illicit substance. They have aspirations that everybody else does. Along the way, like she said, environmental factors, family, and then of course personal choices. But what we all want to do is to help people see there's a better way. You don't have to be caught up in this, and there's a better way.
So since they've been big leaders on stuff that has happened over the past few years in Estill County, I was curious of what the next big thing on their to-do list was. What's next? What's the next big thing that needs to happen in this?
Well, I think that's a great question. And it's to be determined by the folks here locally in our communities and in your community. Obviously, you got to keep gathering the data. And I'm going to give you my personal opinion. This has a largely spiritual component to it. So I think involvement in the churches play a big role in that. There's only so much we can do in medicine. We have medication to help with withdrawals and those kind of things, and we have counseling, but there's a spiritual component to it too, and we cannot leave that out of it. So I think getting more people involved, and particularly the faith-based community.
Well, absolutely. I mean, it's the whole person. And when you go to school to be a nurse or a nurse practitioner, they always talk about the whole person. It's the mind, body, and spirit.
Right.
And so that has been a huge piece of it that has been missing. And so we have to step up our game. And so I truly, in my heart, feel that I'm here to help. And I want to be a servant. I want to be the hands and feet of Jesus. And so whatever we need to do at our clinic is what we really try to do. I mean, whether it's feed someone that's hungry. We just spent a lot of time helping with the flood that we had here in Estill County. And so the drug addiction problem is no different. We're here to help. We don't make a difference in our patients, and so that's what we will continue to do at our clinic. And anybody that needs help, I mean, they can feel free to reach out to us.
Yeah,
at
you
any
don't
point
have to
in
be
time.
a patient of the clinic.
No,
if you
just
need
reach out,
So-
and we're going to try our best to plug you in with the right people or get you the help that you need. And there's nothing to be ashamed of. Don't be ashamed, and we're not going to make you feel ashamed. We're going to try to.
Everybody has struggles in life, and this is a particular struggle that you or I may not have, but we may have different struggles. And, the whole purpose here is that we're trying to help everybody.
Absolutely. Absolutely.
So that's the long answer. The short answer is everybody can continue to work together to address it from all areas. Like Donna said, it's mind, body, and spirit. Let's not leave out the spirit.
Was there a specific experience that kind of turned the page for you guys to put you into the mindset that you're on now with dealing with addiction? Does that make sense?
Well, it does make sense. I mean, I would just say it's a servant heart. I was a paramedic for 22 years before I went into, sort of administration. So that was a servant heart for me. She was a nurse many years before she went back to school to become a nurse practitioner. I don't know, is there one thing that you can think of?
I don't know about just one particular thing, but I have many, many stories of people that really just touched my heart, and I have worked with them side by side and saw them turn around their life. I saw them lose their children. I saw them to a point that, they would sell anything, including their mother, to get the next high. And just in close relationships and building that rapport with them, I've seen them actually turn their lives around, get their children back, get back on a path of just being a productive member of society, reunite with loved ones. And when you see that happen and you've been a part of that journey, I mean, it really warms your heart. This one particular girl, and Leandra probably knows this story, I mean, she came to me broken. And she had nothing. She was living pretty much homeless. She was staying from friend to friend to friend house. Had no money, nothing to drive, no job. I mean, just broken. Lost her children, everything. I worked with her for many, many months. And one day she told me, she said, I'm not a stupid person. She said, I was very smart in school. She said, but I had a horrible home life. I had no support. And when you're beat down every day, that's all you know. So I worked with her and encouraged her to go back and finish up school. And it's been a couple years now, but she was able to get her GED. And she has a job now, and she works. And I feel like she's one of my children. But when you have stories like that, and, she was able to turn her life around, she was able to get, do you know what that GED meant to her?
Oh, I imagine the world.
I mean,
Yeah.
she was on top of the world. Yeah. I mean, she may as well had a law degree from Yale. I mean, she was just on top of the world. So when you see those situations come about, it gets your heart. I can just about tear up talking about it. But I've had many situations like that where you develop that trust and that relationship with someone, and they can do it.
You know, we had one that went through, because of the addiction, ended up, as most do, in the criminal justice system, and was sentenced to, a couple of years in the prison system, but kept in contact with them. Then they come out of the system and just walked them through as soon as they came out. And, today they're a peer support specialist. They're helping other people, and that's 3 or 4 years later. So, and that's why you do what you do. You see that because, let's be quite honest, there's a lot that don't do that. In fact, there's more that don't do that than do it. But when they do it, one human's worth it.
But when you're told your whole life that you can't do anything, or that you're nothing, or you're nobody, or you're useless, or you're just a drug addict, that's what you start to believe. And when somebody comes along and says, hey, I really care about you, I love you, I want to help you, and genuinely means that, that's life-changing for that person. Some of them have never been told that someone loves them.
And I'm not one to think that, sometimes in the medical community it's once addicted, always addicted. You're just in remission. Sometimes I think that does an injustice to the person because it makes them feel that way. And I don't necessarily agree with that. I think you obviously have to watch that. But if you think about it, being addicted is something you did. That doesn't have to define who you are. And later in life, you look back on it and say it was a period of time where I did this. It doesn't have to define who you are going forward. And I think sometimes people feel like that defines me, and I'm always going to be in this bubble, so to speak. I don't agree with that. I don't think that's true at all.
And just along with that same line, we have as a society and even as a community have to learn to be more forgiving and more willing to put ourselves out of our comfort zone to try to help another person that's in need.
Yeah.
We have to be forgiven. Sometimes you need to forget the past. The past is the past for a reason.
Can't change it. You got to look at the future.
You can't change it. You got to look forward.
That's pretty much all the time that we have for this interview today. I hope you guys feel like you can step in and help. At least be encouraged that people are working on this issue. It's not hopeless. That's the main thing that I want you to get from this episode. It's not hopeless. People are busy at work for this. If there's any way that somebody that wants to get involved in helping out in Estill County, could you guys tell us about how they could do that?
Sure. Well, I think there is. I think you start with the OD task force. You make contact with them. It's the HELP team. You see the vehicle around town here, HELP, and it's an acronym for Healing, Empowering Living Program, and that's a place to start. The number's on the side of the vehicle. You can call the hospital or you can call the clinic. Our number is 606-723-2167, and they can call and say, we heard this and we're interested in how to help. There's some other committees that actually do have citizens involved in those committees. More often than not, it's people that have been affected by, usually a child or a parent, and they're actually on the committees to give input from their perspective. So,
okay,
I think that's how you can do it.
Yeah, sounds good. And then, thank you guys so much for everything. Happy anniversary.
Well, thank you. Thank you all.
Yeah.
28 years and 4 babies.
Oh, goodness gracious. Yeah. Thank you guys for tuning in and listening to us today. We really appreciate it. Tell your friends to tune in next time as well. I'd like to thank Donna and John Isfort for being on the show and sharing what they see with us. I'd also like to thank WSKV for broadcasting our show, and also thanks to the Health Department and to Kentucky Rio for supporting the show. This is The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.